My name is Danica. I am 34 weeks pregnant, 34 weeks and 3 days. I'm having a little trouble breathing, so bear with me. Um, I'm gonna talk about my pregnancy journey. It's something that I've wanted to do for a while. Just kind of share my journey, how we got to 34 weeks, the challenges that my husband and I came across, the miscarriage that we had. So I'm just gonna get right into it. I am 34 weeks again, like 3 days pregnant. And in August of 2020, my husband and I conceived our first child, and we lost her or him after about 6 weeks. And we went to the emergency room during the miscarriage just to see if the baby was still there, what was causing the bleeding, what was going on. And it turns out that I had fibroids, and I had no idea that I had fibroids. I'd been going to get pap smears every year for years. I've never been told I had fibroids. They were never detected. I had no clue. So it turns out that I had multiple fibroids, and the emergency room doctor didn't say that the fibroids caused my miscarriage, but he didn't say that it didn't. He just said, I recommend you try again. If you continue to have miscarriages or problems conceiving, then consider getting them removed. But he recommended not getting them taken out. And fibroids, what they are, I'm not really sure how to describe them myself. I know that they are growths. They grow. They're growths in the uterus that are muscular, I think fibrous tissue that grows. And there's no reason why it grows. I know it's more prevalent in African American women or black women, which is what I am. My mom also had them. It runs in my family, aunts, sisters, my mom. So it tends to run in African American families, black women. So it's definitely something that needs to be more discussed, and we need to understand that, or more black women need to know that this is something that they could possibly have before trying to conceive. So I recommend getting pap smears and asking to be checked, or asking for ultrasounds just to make sure you don't have fibroids, because I wish I would have known I had them sooner, so I could have done something about them sooner than trying to conceive, because they can cause preterm labor, they can cause issues, they can cause pain. And me being pregnant right now at 34 weeks, in the beginning of this pregnancy, we conceived this pregnancy, we decided to not do surgery to remove the fibroids. We decided, let's try again. The doctors kept telling me, there's a chance for another miscarriage, but try 2 or 3 more times. If you have 3 more, we'll consider taking them out. Of course, who wants to go through 3 more miscarriages just to see if it works? But my husband and I, we decided to try. My husband and I decided to try one more time. We started to try again, and by November 2020, we conceived again. So we went for an ultrasound at 8 weeks, and there was one fibroid that was close to the baby. And my doctor told me that it could cause issues if it began to grow and push the baby out of place, or it could cause issues. But she said at this time things were okay, but we'd have to monitor the fibroids. And it's just something you don't want to have to worry about. If you can get them taken out before you get pregnant, or while you're young, before you're trying to conceive, it just makes things a lot easier, and it's something that I wish I would have known about. So I do want to encourage other women to get checked, ask questions. If you're having painful periods and doctors tell you, oh, that's normal, nothing's wrong, it's just your menstrual cycle, that's how it's supposed to be, and you feel like something is wrong, ask them, can you check? Can you do an ultrasound? Can you check for abnormal growths? Can you check for fibroids? It runs in my family. Or can you just check for fibroids? Because period shouldn't be extremely painful. You shouldn't be vomiting, constantly dizzy, in extreme pain, can't go to work. It shouldn't be like that. So that means something could be wrong, and it is worth getting checked out. I didn't have symptoms with my fibroids. I Really didn't, I had no idea I had one, much less multiple ones. So, I had no reason to even check. But looking back, I do wish I would have just said, can we just look and see how everything looks before trying to conceive? It's just worth getting checked out. So, with this pregnancy, now that I am 34 weeks, the fibroids are more painful when she does kick them because you definitely can feel them when the baby moves and when she rolls and she kind of kicks them or moves them. It can cause some pain, so it's definitely a little bit painful. So, like I said, we conceived this one in November. The fibroids were there, but they weren't a problem. I was on progesterone pills for the first 12 weeks just to make sure the pregnancy stuck. So everything was fine. From November to March, things were fine. All of a sudden, I started having just pain in my back, my low back, and lower in my abdomen. And I thought, oh, this must be normal. Every woman goes through pregnancy pains, and I'd never been pregnant before, so I thought, oh, it's normal. Let me just suck it up. Other women have been pregnant. It's just discomfort. I had been nauseous since I found it out for 6 weeks of pregnancy on. I'd been nauseous, so I was kind of used to being miserable, but I had never felt the pain I was feeling that day. It was March 26th. I woke up and I just felt pain, and I'm thinking maybe I'm just, constipation happens a lot in pregnancy. I'm like, maybe it's just that. Maybe I need to drink more water. So I got up and went to work, and the pain it got worse throughout the day. And I just thought, I just gotta drink water, just rest, suck it up. Women get pregnant all the time, they deal with it. But the more I asked one of my coworkers at work that day, did you have cramping or did you just feel bad a lot during your pregnancy? Or, because I felt not well a lot of the times because I was vomiting and so nauseated, but just constant discomfort. And I'd been having cramps for a couple weeks, but it wouldn't last long. But this day it was lasting, and I'm just thinking maybe I have, like I said, constipation. And my coworkers would always say, "No, I didn't have that," or "I was fine," or so I'm like, maybe I'm just different, maybe because I'm so small. So anyway, I went through the day at work. I got home, and the pain was still pretty consistent. I went to sleep Friday night, woke up Saturday morning out of my sleep. I was woken up by the pain from my low back, and just it felt like cramping, just very extreme discomfort. Not extreme, but it was enough to wake me up. And I'm thinking, you know, could I have a UTI? Could something be wrong? Let me see if it stops. So I went through Saturday, and it kind of got a little bit better. So I'm thinking, oh, it's just, maybe it's just the regular aches and pains. Maybe it's round ligament pain, which happens as you grow. Your muscles, they can get sore. Maybe it's just that. Saturday goes, Sunday comes, and I woke up feeling okay. I still had the discomfort, but it wasn't extremely awful. I had a little bit of back pain. And so as Sunday went on, I noticed I was starting to feel a little bit worse, and the cramping got worse. And so I'm thinking, something's not right, something's wrong. By Sunday evening around 7 p.m., I just was just laying in bed. I could barely get up. I would try to use the bathroom, and it was just very uncomfortable. So my husband took me to the ER, and I'm thinking it's just going to be a UTI. We'll go, we'll get something, antibiotics, and we'll come back home. So we get to the ER, we go in, and they start monitoring the baby's heart rate and checking on her. She looks great. And they start checking for contractions and, making sure that I'm okay. So I was okay, but they told me I was having contractions, and they did an ultrasound, and my cervix was actually shortening. So the week before the ER visit, 2 weeks before the ER visit, I was 3.6 centimeters. My cervix was 3.6 centimeters. It had shortened to 1.5, which I never understood any of this until I actually went through this experience that 3.6 is the normal length of your cervix. That's how long that's a good length in pregnancy. Going from that to 1.5 2 weeks later was not good, especially because I was 22 weeks. So the fact that it had shortened that much, they told me that was pretty much not good, and they told me that there was a chance I could go into labor that night at 22 weeks. So they asked me how far along I was when they told me I was having contractions and I could possibly go into labor. They said it was a serious issue, and if the baby would come, they would try to do what they could depending on how far along I was. I thought I was 23 weeks pregnant because I had been to a couple different doctors at that point looking for the right doctor. Because if you don't feel comfortable with the doctor or the OBGYN that you have, you should find another one, find someone you're comfortable with that you can trust. I had just found another one, and he told me my due date was a certain date. And I remember the other one had said something else, or maybe I had heard wrong. And I also had a few private ultrasounds because with COVID, a few months ago, husbands weren't allowed, partners weren't allowed to go with you into the rooms. So private ultrasounds allowed my husband and my family to come. So we did a few private ultrasounds, and they told me I was measuring ahead. My due date was a little bit sooner than what the doctor had said. So I went with that thinking, oh, if she's measuring bigger, she'll come sooner. Well, this wasn't the case. So anyway, I told the nurses and my doctor that I was 23 weeks pregnant. They said, okay, at this stage, the baby is peri-viable. There's a chance that she can be saved. So this hospital doesn't really deal with extremely premature infants, but will, if you go into labor, she'll be born. We'll give you steroids before you give birth to her. That'll give her a chance for her lungs to develop. You'll deliver. We'll have her flown by helicopter to another hospital that specializes in premature infants, and then they were going to send me when I was stable. So that was the plan. Once again, they said she was peri-viable, which meant they would try. There was no guarantees. She could have severe mental disabilities, trouble breathing. There could be a lot of things that would be wrong with her, but we still wanted to try to save her. The nurses left. They came back and told me, actually, we just talked to your last OBGYN, and your due date is not till this day, which was after what I had told them it was, and I was actually less farther along than I thought I was. I was 22 weeks. They told me, so at this stage, you're at 23, you're peri-viable, where we attempt to resuscitate and save the baby. But if you're only 22 weeks, there's nothing we do. We don't try to resuscitate. It's pretty much a waste of resources, or it doesn't make sense to try because it's the chances of survival. The chances of survival, sorry, I can't speak and breathe. It's hard for me to speak and breathe. The chances of survival at 22 weeks were slim, and they don't usually even attempt at that age because there's nothing that they usually can do. So I asked them, is there any way to stop labor? Can we stop the cervix from dilating or from shortening? Or she said, once you're actually in active labor and your cervix starts to dilate, there's nothing that they can do to stop it or save the baby if she was to be born. So they checked my cervix multiple times that night from when I first arrived, and it hadn't dilated. It was just shortening, but it wasn't dilating, which they said was good news. If I didn't dilate that night, they would have me transferred to another hospital that specialized in premature infants and preterm labor, more so than what the hospital I was at could do. It was an awful night. It was a long night. They checked my cervix constantly. It did not dilate, and it appeared not to be getting any shorter. So my doctor said she checked me one more time that morning around maybe 7 a.m. and said, it's good news, you're not dilating. We're going to transfer you by ambulance to another hospital. So this was good news. It was a long, horrible night. I kept thinking I'm going to go into labor. I'm never going to get to see my baby in one of those newborn hospital beds. And they transferred us from the ER triage room to, I actually got admitted. And the room I got admitted into was a newborn, like a labor and delivery room that had the little newborn beds that they put the baby in with the warmer on top. And I remember feeling like I'm never going to get to see my baby in that warmer because she's going to come tonight. And the doctors pretty much prepared me for the worst. And it didn't happen. I was transferred by ambulance to another hospital that morning around 8 a.m. We go to another hospital. They checked me again. No dilation, no more shortening. But I was having contractions consistently throughout the night, and I was still having contractions the next day. the doctors at the next hospital said the fibroids could have been responsible for the constant contractions. Because, like I said, I had multiple ones, and there's one that's a little bit larger than the others. And they said that one might have been irritating my uterus. Something might have been setting off the contractions. Maybe the fibroids were being irritated, and they in turn were irritating my uterus. There was really no answer for why the contractions even started, or why I was, why the fibroid was irritated, or why my uterus was irritated. It was pretty much a guess by the doctors, because I asked them, "Are you sure it's the fibroids that are causing the contractions?" She said, "No, I have a suspicion that it could be, but there's really no way to tell what causes contractions all the time. But the fact that I did have those fibroids, it could have been that." So they kept monitoring me. They monitored me for 3 days. No more shortening. The contractions stopped. They put me on medication for the contractions. They had stopped. I was stable enough to go home, and they sent me home with vaginal progesterone that had to be administered every day vaginally. So I went home for about a week. I did that every single day. We had a follow-up appointment the next week. I went home Wednesday, and we had a follow-up appointment the next Tuesday. We go to our appointment at a regular doctor's office, and my cervix had shortened from 1.5 to zero point 0.8. So this meant I was pretty close to dilating, or once it shortened completely, I assume my cervix would have dilated. I'm not an expert in these things, but I do assume it was getting shorter and shorter, which I barely had any cervix left. 0.8 is pretty much nothing. So the doctor told us, go back to the hospital immediately, and we're going to do an emergency cerclage. This is our last ditch effort to keep this baby inside. It was very traumatic again. I'm thinking, I thought things were better. I thought it would stop shortening. I'm on the progesterone. I've been doing the progesterone every single day, and we're still having these issues. So my husband and I went back to the hospital. They admitted me again, and we ended up staying for 3 days. They did the emergency cerclage the next morning. The cerclage was not painful. What a cerclage is a stitch that they put in your cervix, so it keeps it shut, so it stops shortening, and it stops the baby from coming out prematurely. So we got that done. It didn't hurt. They gave me anesthesia. They gave me an epidural, actually. So the process of getting it didn't hurt. After you get the stitch in, or after you get the cerclage, that is pretty painful. Because, once the medicine wears off, you can feel everything, and it feels like extreme cramps. I don't know if every other woman has had the same experience I had, but I was in excruciating pain with the cerclage after the medicine wore off. Vomiting, it was rough. But a few hours after, and they gave me some pain medication after my Tylenol had worn off, because I got Tylenol immediately following the surgery because my epidural was wearing off, and I'm starting to feel cramping. So I asked, could I have something, because I know this is probably going to be bad, because I could feel the cramps coming in. They gave me Tylenol. That did not work, so they gave me something stronger. About an hour later, that worked a lot better. I did have some nausea, but I was able to get some sleep after that. It is a little hard to use the bathroom afterwards, and you do feel a little bit numb. There's some bleeding, but it's not the most awful thing if you have the right medication and you can rest. I stayed at the hospital a day after the cerclage was put in, just so they could monitor my cervix. The cerclage placement was successful, and they were able to lengthen my cervix with the stitch from 0.8 to 2.3, which was much better. We were sent home again about a day after the cerclage was done with progesterone, and told to continue the progesterone vaginally, and we had to have continued follow-up appointments with a high-risk doctor as opposed to my original OBGYN, because I was now high risk because of my stitch. We get sent home, and things seem to be going okay. The stitch has held up. We went to follow-up appointments. There's been no shortening. I've had contractions. We've gone to the ER a couple times since have had the cerclage put in just to make sure the contractions wouldn't cause a bursting of the cerclage or of the stitch because I was still having unexplained contractions. So we went to the ER just a couple times, and they would give me some medication, or a certain shot to kind of stop the contractions, and I'd be sent home. That was pretty much from 22 weeks on. We are now 34 weeks, going on 35 weeks. The baby is healthy. She's growing. She's 5 pounds now. And when I go back to that night, March 28th, they told me she possibly wouldn't make it. And doctors pretty much prepare you for the worst. So I was pretty much prepared to go into labor and say goodbye. And the fact that, she's still here, that my whole family was praying for us. I got text messages, my sister-in-law were praying for you. My family came out. Just having so much support really helped, especially going through that really hard night where we thought she wasn't going to make it. Especially after my last miscarriage, I thought, I felt dumb for buying clothes for this one and really thinking, oh, this is going to work. I just thought, I shouldn't have said anything to anyone. I was dumb for thinking this pregnancy was going to last. We just lost the other one. I have fibroids. My body just can't do it. And I felt like I was a failure to my husband because I lost our last one. And now here we are in the hospital, possibly going to lose this one at 22 weeks. It's very painful. It's very traumatic. And you feel like, what's wrong with me? It was very hard. But to go from that to 34 weeks pregnant with a healthy baby girl, who the whole night they told me I was going to go into labor that night in March. She was kicking, her heart rate was strong, she looked great. She let me know, hey mom, I'm okay. And, she's a fighter. She went through the cerclage with me. We've been through a lot together, through contractions, and she's never been in distress. She's been okay. Her heart rate's been consistent. Her movement has been consistent. And, God has truly answered my prayers, my husband's prayers, my family's prayers. And in a few weeks, we get our cerclage taken out. Around 37 weeks, they're going to take it out. And after that, she should make her arrival within a couple of weeks. Sorry, my nose. So I wanted to share my story with you. Sorry. Um, just concerning fibroids. I keep saying, sorry. This is my first video. And I'm a little nervous, but I wanted to just get on here. And something I wanted to do for a while is share my story and my pregnancy, because I feel like it could help other women. Just because you had one miscarriage or you lost one doesn't mean that everyone's going to be the same. It doesn't mean something's wrong with you. Fibroids, there are options, there are ways that you can get pregnant. And I don't know why bad things happen. I don't know why I had the miscarriage. Even though we did pray, I don't know why we went through this traumatic experience with this pregnancy. But I do know that God protected her and He protected me and He answered our prayers. And we're sitting here today with a healthy baby, and we're going to get to meet her in a few weeks. We're not there yet, but I'm trusting God. He's brought her this far, that He's going to bring her here into the world safely. So I hope this encourages other women. When it comes to fibroids, make sure you get checked. If you have questions, ask your doctor. If you feel discomfort during your menstrual cycle, nausea, vomiting, intense pain, that's not normal, make sure you get checked out. If you're going to your regular OBGYN prenatal appointments and you feel like something is wrong, tell the doctor. Don't let them rush you out. Don't let them push you out. Don't let them make you feel like you're bothering them. This is your time. This is your appointment. This is your child. Make sure you ask what you need to ask. Say what you need to say. Because I didn't, and I felt like I was rushed a lot of the times. And I would come with questions written down and questions I wanted to ask, and I would feel so rushed that I'd forget them. I wouldn't even read all my questions because the doctor was trying to get out. No more of that. After what we went through, whatever question I have is going to be asked, and I expect full attention. So, just be assertive. Say what you have to say, because it's, you're fighting for your baby, you're fighting for yourself, and you deserve a good and a healthy pregnancy. So I hope that this answered some questions about fibroids, about preterm labor, preterm contractions, and also a cerclage. I hope that this helps other women to stay positive and keep going, because it was very difficult, and it's still difficult now. I was put on bed rest after the cerclage, I wasn't able to go to work, and dealing with work and bills and disability, all that stuff, mentally, bed rest, all that stuff kind of goes with a high risk pregnancy sometimes. So hang in there, you know, keep praying if you believe prayer works. Stay positive, take care of your baby, take care of your body, and just have faith that things are going to work out. So thank you guys for listening to me, and my name is Danica, and I'll probably post more videos. If you guys like this video, I could do more pregnancy videos. I could also document my pregnancy or my actual labor and delivery journey and let you guys know how the removal of the stitch goes. If we have any more contractions, I can answer questions you guys might have about cerclage placement, how contractions might feel, all of that stuff. Progesterone, vaginal progesterone. I can answer a lot of questions you guys might have and just give you encouragement if you need it. So thank you guys for listening, and I hope you have a good day.